A growing number of healthcare workers are being paid 2, 3, even 4 times more than others by the same hospital to do the exact same job, working side by side, including Basil Byfield and Keon Johnson. Both are highly skilled emergency room nurses.
I've always loved the merge. I've done it for over 30 years.
Byfield works in the public system, caring for patients at Oak Valley Health's Markham-Stouffville Hospital.
It can be demoralizing for the regular staff, having to do the same job but getting less pay.
I've been working with the agency for 7 years.
Johnson left her full-time hospital job. With 3 kids, she says her work schedule was grueling. Johnson's now studying to become a nurse practitioner. Working for a private nursing agency allows her to choose her own hours.
With the agency, the primary impetus would be, of course, the flexibility that it provides, as well as the financial increase.
All of the units at the hospital will tell us how many nurses they need.
And there's no shortage of work.
Today it's 4, but moving forward to Saturday, a day 12 or a night 12, 24-hour period, I need over 20 nurses to fill the gaps.
That's daunting. Terry Stewart McEwen was a nurse for 38 years. She's now the chief nursing executive at Oak Valley.
As an organization, you're saying I either put my patients at risk, my staff at risk, or I pay $300 an hour. And that's what we all had to play out across the province.
You heard that right, $300 an hour to hire a nurse. Private for-profit agencies call it surge pricing, kind of like Uber. The higher the demand, the higher the price. Other agencies charge between $75 and $150 an hour. Public hospital staff nurses make around $40.
Last year, we spent over, in this organization, $4 million. And we are a medium-sized organization. You can imagine adding that times all of the hospitals. That's a huge cost to our healthcare systems.
Most provinces are now paying millions more for the same workers. In Quebec, the numbers are eye-popping. The province's use of private staffing agencies cost taxpayers nearly $1 billion last year, $3 billion since 2016. Now Quebec's health minister wants change.
It's costing a lot. You've seen the cost of that. That doesn't make sense.
Quebec recently passed a bill limiting the use of private health agencies. The goal is to ban hospitals from using them by the end of 2025.
This has been a crisis that nurses have been warning about for 20 years now, at the very least.
Nathalie Steak-Doucette was a nurse for over a decade. She now teaches nursing at McGill. She says private healthcare staffing agencies are like vultures, but they're a symptom of a deeper problem.
The private agencies are taking advantage of the fact that our healthcare system is a meat grinder for nurses.
Burnout, the lowest wages in the country, and punishing work hours, including forced overtime in Quebec, led to healthcare workers fleeing public hospitals. Quebec's now promising it will become the employer of choice once again. Steak-Doucette is somewhat optimistic.
I would go back if I knew that there'd be safe ratios.
Studies show having enough nurses to care for patients saves lives. There are fewer medication errors, and staff can spend more time with patients and their families.
When you leave at the end of the day, you mourn with people, you cry with them, you experience their...
Some fear other provinces aren't learning from Quebec's mistakes, including Ontario, which fought public sector nurses over wages and plans to expand private for-profit surgery clinics.
We try our very best to care for people. I feel like we're not respected in the sense that our needs are not being met.
Until they are, taxpayers will continue paying into private agency profits instead of investing in public healthcare systems desperately in need of help.
Christine, is getting rid of the temp agencies even doable?
All the nurses we spoke with don't think so. They also said these agencies are predatory. They're no utopia, but some of them have been around for decades. It's just they never offered steady work until now. They're businesses. They're seeing big money to be made. Hospitals need these workers back. It is life or death. So if provinces want to put these agencies out of business, they're going to need to figure out how they're going to hold on to the healthcare workers they still have and how they're going to recruit new ones.
But how are they going to do that?
Well, different provinces are taking different approaches. Nova Scotia recently announced it'll give nurses $10,000 signing bonuses with conditions. But British Columbia is really leading the way here. It's the first province to adopt nurse-to-patient ratios. And when you think about the millions, even billions that are being spent, hiring more nurses and improving working conditions makes sense financially and for patients.
All right, Christine Birak, as always, thank you.
You're welcome.